I'm Dr. Howard Zucker, the doc in Docology. When I lived in Switzerland, I stopped by the bakery shortly after arriving there, bought a loaf of bread, took it home, had a few slices. But by the next day, it was already stale. Crazy, absolutely crazy. I went back to the bakery. I was waving the bread in my hand, asking for a refund. And the baker said something to me in French. I didn't understand it, but it was unmistakably firm. And a woman near me provided a translation, and she said, "We don't put preservatives in our food like America. And no refund." I said to myself, how does she know I was American? But in that Swiss bakery, I confronted the value of freshness over shelf life. And it made me wonder, what is it in some of the food bought in American supermarkets that lets it stay on a shelf for weeks? What do we give up or risk for that kind of artificial longevity? And that stale loaf of bread, it taught me more about food than any nutrition label ever has. So our guest today is Marion Nestle. She is the professor of nutrition, food studies, and public health at New York University, award-winning author and researcher who has studied for decades the scientific and socioeconomic effects of food choices, food safety, and food marketing. She is an international expert on a subject that is of the highest priority for the Secretary of Health and Human Services, Robert F. Kennedy Jr., and that's food additives. And she is not related to the Nestle's company, even though her name is spelled the same. So welcome, Professor Nestle. Thank you for joining us. I'm so glad to see you here.
Oh, glad to be here.
Great. Thank you for coming on the podcast. I thought I'd begin with, before we even talk about food additives, I thought maybe we could begin with, how did you get involved in this movement back when you did, when it didn't have the momentum that it has today?
Well, the easiest way to explain it is I was handed a nutrition course to teach on my first teaching job. That was 50 years ago. And I was trained in molecular biology and was teaching cell and molecular biology in a biology department that had a pretty unusual rule, and that was that you had to teach anything that the department needed, whether you knew anything about it or not, on the theory that you could learn faster than freshmen and sophomores. And I was handed a nutrition class to teach because the students in that biology department were demanding human biology classes. And it was my turn to teach a new course. So, and as I've said many, many times, it was like falling in love. I've never looked back.
Excellent. Unbelievable. I mean, and look at where we are today. I thought there's a phrase out there, we are what we eat. Mm-hmm. And so food additives are filled with chemicals, or they are chemicals. Are we now filled with chemicals? So I thought maybe you could tell us a little bit about, what are food additives? What's the real definition of them? Because everyone hears that phrase all the time.
Well, I don't think there's any particular definition. It's just things that get added to foods that aren't in the foods to begin with. So, your use of the word chemical is interesting here, because food is chemicals. I mean, thousands of them, literally. And these are other kinds of chemicals, which may be natural or artificial. They could be things like sugars. They could be things like salt. They could be things like red dye number 40, to pick a random example. And they're put in food in order to preserve it, which, there's your bread. To preserve, to add texture, to add flavor, to add color, to compensate for what's been removed from the foods in processing. They have all kinds of purposes. Vitamins are additives.
So has anyone looked at the long-term effects? We put these additives in there, and whether it's the red dyes or the yellow dyes or the sodium benzoates and all the other items that fall under that category. Has anyone studied their long-term effects on children, adults, or anyone for that?
It depends on what you mean by studied. There's been tons of research on these additives, on some more than others. But think about what's involved in that kind of research. You need to have two populations of people who have them and who are eating the additives, people who aren't eating the additives, or you add the additives and see what happens. Um, they're not consumed in very large quantities. So to make up for the problem of trying to find people who are willing to be subjects in these kinds of experiments, they do the experiments in animals. And you look to see what happens in animals. If it's really terrible, I guess you take the additive out of circulation. If you don't see any big problem, you leave it in. We have in the United States a regulatory system for what goes into our food that is kind of put it there and let's see what happens. This is very different from the system in Europe and other places where they follow the precautionary principle. If there's any indication at all that something might be harmful, it doesn't get into the food supply unless you can prove it's safe. In the United States, you have to prove it dangerous.
Why is that?
Do.
Why is it the United States has one system like that, and Europe or other countries have this other system where one would say, well, if there's any chance that something's a little risky, why not take it out?
We have a very powerful industry here. And the many of our governmental institutions are captured by industry. They don't want to do anything that's going to cause problem to industry. If it hurts business, it's bad for the economy, and that makes it bad for America. So we're Americans. We do things the way we do them.
So then that brings us back to what's happening now in Washington, right? So Robert
Yes.
Kennedy is sort of saying that let's get them out, let's take these products out, and he put out that report last week saying that there are make our kids healthy again, and part of it is the risks of food additives and also ultra processed foods, which I wanted to ask you about. So do you think that the approach is correct to sort of get them out? Because that's what he was saying. He said, get rid of the dyes. I'm just quoting him. And then one by one, we're going to get rid of every ingredient and additive in food that we can legally address. Is that a good approach?
Well, it's about time somebody took it seriously. I mean, food advocates and advocates for health in general have tried to get particularly the artificial dyes out of foods for years, and companies have promised to get rid of those dyes. But when they do and replace them from vegetable-based dyes or dyes that seem to be safer, the colors aren't as vivid. They fade, they get paler, and people don't buy the products. Food dyes are really interesting because they're there to make up for the fact that the foods have been processed in some way and that nutrients and other good things have been removed from them. And so they're cosmetics. But if you look at the research on cosmetics in food, it shows very clearly that foods taste better if they're brightly colored. So if you take the same food and color it brightly and color it blandly, people will interpret the more brightly colored one as tasting better, particularly kids. And so that puts food companies using these dyes in a very difficult economic position. If they get rid of the dyes, they lose sales, and they have been very reluctant to do that. The cereal companies, for example, have promised in 2015, 10 years ago, they promised to get rid of the dyes. And now they may have to do it because they're under an enormous amount of pressure from states that have now passed laws.
So they promised to do it, but they did not do it. Is that just because there was enough pressure by the food lobby to prevent that from happening?
No,
Or
the companies experimented. General Mills and Trix, for example, took the dyes out of Trix, and Trix then had sort of, I think, rather attractive fall colors, but not everybody agreed. It went from neon to fall colors, and the sales went down. That was the end of that.
economics
Yeah.
comes down
Oh
to
no, this
economics.
is This is all about profit.
Profit, yeah.
This is a profit-driven industry.
Well, we have these little kids who are looking at taking these cereals off the box, off the shelves, right? And some are, everyone's concerned that there's a risk that some of these kids may be getting health issues as a result of this, particularly the concern about ADHD. What have you learned about that, and what's the latest on that information?
Well, this is an old issue dating back to the Feingold diet of the 1980s, where Feingold was a physician who said that these color dyes and other additives in food were making kids hyperactive. And that if you remove these dyes, kids would not be bouncing off the walls in quite the same way. And there was a lot of controversy about it because the companies didn't want to remove them, but also because it was very difficult to do research. You don't want to put kids on diets that have things in them that you think are harmful. So it's very difficult to do controlled studies, but there were controlled studies done in the 1980s. And these studies and all of the subsequent studies have shown pretty much the same thing, which is there is a subgroup of children who seem to react very consistently to these colors with symptoms, but most children don't. So, okay, what do? If you use the precautionary principle, you get rid of them. You don't need these dyes. They're not essential. They have no nutritional value or safety value. They're cosmetics. So in Europe, you get rid of them. In the United States, you keep them in until you can prove harm. And up until now, the Food and Drug Administration has said these things are not harmful at the amounts being used. So RFK Jr. comes in and says, we're going to get rid of these, and states start passing laws saying you can't sell products with some number of dyes within the state. And if enough states do this, and if the laws are different, then there's going to be pressure on the federal government to clean that up, because food companies can't make two kinds of products, one for one state and one for another. They just can't do that. Although they can do that in countries. And then the other point is that in Europe, they sell these products without these dyes. They use other dyes in Australia and New Zealand and in the UK. So they're not necessary. They're replaceable. The companies don't want to replace them. It's going to be interesting to see what happens.
And with regards to, so those are the dyes, but also all of this ultra processed foods, the challenges that we're experiencing there. Do you feel that that will change as well as a result of some of the pressure that's being put upon the industry by RFK Jr. and others?
Well, I certainly hope so. Ultra-processed foods are industrially produced, designed to be irresistibly delicious, if not addictive. We can argue about the addictive part of it. They contain additives, usually, and they can't be made in home kitchens because you don't have the equipment or you don't have the chemical additives. And there are now literally thousands of studies that link ultra-processed foods to poor health outcome. And that means obesity, type 2 diabetes, heart disease, certain kinds of cancers, overall mortality, the works. And okay, those are observational studies, and correlation is not the same as causation. But there's one clinical trial, actually there are now two clinical trials, one done at NIH and one done in Japan, that show that these foods induce people to eat more calories than they would by otherwise, and a lot more calories. And so it's even in short-term experiments, people eat more of these foods and they gain weight right away. So for that alone, you would think, let's encourage people to eat fewer of these kinds of foods. And whether it's the processing or whether it's what's their quote unquote addictive nature is still being debated and studied. But but I think the implications for dietary guidelines are pretty clear. If you don't want to gain weight, don't eat too many of these foods.
Could you talk a little bit more about the addiction issue? Because I think that's a very important factor in what could happen. I noticed this the other day. I had my kids at a park just for an outdoor movie, and there was a bag of potato chips, and boy, their hand was in that potato chips, and it just kept going back into the bag of potato chips. And I said, boy, this is a little bit of like an addiction. And I suspect that the studies have shown, if you looked at the brain, like what happens in different parts of the brain, is there a nourishment sort of center where this addiction is, where these foods are causing a little bit more of an addiction?
Everyone is looking at dopamine, but the most recent study done on these showed that they did not induce dopamine in the same way that addictive drugs do. But I'm not an expert on addiction, but the people who are say that these kinds of foods have very much of the same kind of properties as addictive drugs or substances to which people feel addicted. And certainly if you ask people who feel that they have food addictions, and there are many people who do, they describe the same kind of behavioral kinds of things that people who have drug addictions do. And then we're now seeing with these GLP-1 obesity drugs that those drugs interfere with people's desire and people's feelings of being addicted to these foods. They break that cycle. And there's evidence from, Michael Moss's work in his work is showing that food companies formulated these foods to be irresistibly delicious. And there was this famous chip ad saying you can't eat just one. That was the whole point. That was the whole point. And one friend of mine put it in just a wonderful way. He said, if you're eating a salad, you know when you've had enough salad. You eat a salad, you stop. Fine, I've had enough salad. But you put Oreo cookies in front of somebody, they can't stop.
Yeah.
And
particularly children,
yeah,
children. Right?
and particularly children. I mean, you give children a choice of sugar and anything else, they're going to choose sugar. So that's where it is. And so the idea that you're going to put some restrictions on ultra processed foods is kind of exciting from a policy standpoint. I'm interested to see what those policies look like. And I'm interested to see whether RFK Jr. is willing to take on the food industry, because ultra processed foods are the most profitable foods they have.
Well, it sounds like he wants to. I mean, it sounds like this is part of the agenda in trying to help make kids and everyone, for that matter, healthier. So I hope he is successful, because it seems like this has been a problem for, as you've seen, many years.
Well, we won't know for another 2 or 3 months what the policy agenda is. There's to be a second report that comes out in 80 days after the first one. And the first one is an analysis of the problem. The second one is the one that's going to talk about the policy agenda. I'm interested in seeing that one, because if he wants to do what the first report, if he wants to fix the problems that are described in the first report, he's got to take on the food industry, the agriculture industry, the chemical industry. You go down the list. These are powerful industries with powerful lobbying apparatuses, and nobody's ever been able to take them on before. Good luck to him.
So the FDA usually has the concept of substances are generally recognized as safe, right? Mm-hmm. So that's going to have to change in order to, I mean, you could still say they're generally recognized as safe, but you're going to have to address that as well. Safe for who? What's the evidence? All of that's going to have to be looked at as well, and if they're going to be successful.
Well, because the FDA is, you have to understand, the FDA is a under-resourced agency. It's been under-resourced since the early 1980s, when in President Reagan's deregulatory agenda started giving the FDA more and more to do, and Congress gave it more and more to do without providing nearly enough money and to pay for staff to do these things. And you might have noticed that the FDA staff has just been cut by 3,500 people. So it's unclear to me how all of this is going to work. But you had one of the big problems facing the FDA was what to do about the thousands of chemicals that are in food. They didn't have the staff or the resources to deal with the kind of research that needed to be done. And so they left it up to industry to do it. They turned the responsibility for demonstrating the safety of new additives. First, they declared all the ones that were on the market to be generally recognized as safe, and any new one, the food industry had to demonstrate safety. So the food industry would get a food company would get its own committee together, and that committee would say, here's the research that proves this thing is safe. And they wrote the FDA a letter, and the FDA didn't do anything about it. So, end of story. So, for years, advocates for food safety have said they need to close the grass loophole, which is leaving it open to industry to decide whether its own things are safe when they have a clear conflict of interest. So he wants to take that on. Fine. Who's he got to take that on? They just fired 3,500 people.
Yeah, it's sort of an inconsistency there. If you want to do this, you're going to need the staff to do it. If you don't have the staff, then how are you going to achieve?
It's not going to get done unless you just automatically cross them off.
Right.
So I don't know. I'm waiting to see how they're planning to do all this.
Right. And GRASS, just for the audience, is generally recognized as safe. This is the acronym for that. One of the other issues that I've noticed is that there are a lot of these companies, these startup companies, popping up everywhere with plant-based alternatives and other ways to address some of these challenges we're facing, cultivated dairy products and things of that nature. Can you talk a little bit about that? What do you think about that option where you won't have the additives there?
Oh, yes, you do. You certainly do.
Even in those
They're ultra processed foods. They're concoctions of ingredients. I don't know about the lab based, but certainly the plant based. The plant based are concoctions of ingredients. They may have 10 or 20 ingredients in them that you can't make them in your home kitchen. So they're ultra processed by definition. Whether they belong in a category of ultra processed that's excused from the definition and from concerns about it remains to be seen, because we don't have the research on the plant-based products. The cell-based products, which start with animal cells, are not on the market yet because the logistic problems for creating enough of these cells to be able to make them into products at a sufficient scale to get into supermarkets just isn't there yet. It's too easy to contaminate cell cultures in large quantities. The cultures have to be fed. If you've got cells that are growing, those cells have to be fed. And every time you introduce feeding, you introduce the possibility of loss of sterility. It's just a huge problem. And it's one that's not solved yet. Maybe it will be solved. I don't know. So I don't know. Nobody wants to eat these things. Nobody wants to eat them. If you want to eat, you want food. So these industries they're having a little trouble right now.
Well, maybe it's just the beginning. We don't know, right? It's just the beginning right now. But the lab cultivated ones, they seem to say that they're doing this without additive-free products. But we'll see. As you said, it's not easy to grow cells and to do that. But everything has to have its beginning.
Anyway, they're not on the market yet, so it's not. You can't tell.
Right. But one last question about these additives, and then I want to go to our audience. But do you feel that they're changing our gut microbiome, the bacteria inside of our bodies? Because it seems like one keeps adding all of these different products, and our body is designed to clear things a certain way. And so I wonder whether it's sort of altering what's in our gut and then affecting inflammation and other things that our body has to handle.
Well, everything we eat affects the microbiome, everything. And there are literally trillions of bacteria in the human digestive tract. And it's very exciting and interesting and very hard to study, or it's very hard to know what the results of the studies mean for health or clinically or whatever. So yes, I'm sure they change, but so what? I don't know. I don't know the answer to the so what.
What do you think are three key takeaways about these food additives, whether it relates to the issues of what's happening in Washington right now, or just in general for the public regarding their own personal health?
Well, the main one is that they're not necessary. They're not very well studied, and they're replaceable. You know, if you want to eat food. Don't eat concoctions of additives. You know, I'm very happy that we're going to be getting rid of color additives, and I hope we are. But that's not going to make America's children healthy again. It's going to take much more than that.
Sure, it's just one part of a huge initiatives that have to take place, whether it's related to food, but all the other things that children are exposed to that affect their health and well-being. Thank you. We reached the point in our show where we go to our subscribers because they are our most important guests out there. And Kat's going to tee up the questions for us. And I do mention always at this point in time that everything we discuss on the podcast is just for informational purposes. And if you have a medical question, you really should talk to your doctor who knows your medical history. But Kat, can we jump onto the questions that we have today?
Absolutely. So I'm going to go ahead. I was going to ask the first question, but Rick raised his hand. So we're going to bring Rick up first.
Okay.
He has a question.
Okay, first, I just have to say thank you, Professor. You have been a leader, a goddess in this field for such a long time. The country's finally catching up with you. And you couldn't be on with a better person than Howard, who's just also been an incredible leader. My question, it relates to the medical world and your thoughts, both of you, on the integration of nutrition into medical care, whether it be med school or actually in a physician's office. And just quote one stat, a Bipartisan Policy Center put out a report that said 86% of doctors actually don't feel comfortable talking about nutrition. So your thoughts on medicine and nutrition medical practice. Thank you.
Well, I have to tell you anecdotes on this one. I taught nutrition to medical students from 1976 to 1986 at the University of California, San Francisco School of Medicine. And when I started teaching there with a mandate to teach nutrition to medical students, we were already 20 years past the first American Medical Association conference on the need to teach doctors about nutrition. So from 1960, that's 40, that's 65 years ago. So for 65 years, there have been conferences and complaints that doctors don't know anything about nutrition. I don't even know where to begin. The exact same problems that were barriers to teaching doctors about nutrition in 1976, when I started teaching there, haven't changed. They've only gotten worse. The medical curriculum is about treatment. It's not about prevention. Nutrition is much more complicated than most people think. Everybody eats, everybody thinks they're an expert. It's really pretty complicated. It would take a lot to teach students about it. I had lectures in various courses. I ran a 1-month block clinical elective. I did a whole lot of things, and even that wasn't nearly enough. And I don't know about you, but as a patient, when I see my doctor, I'm lucky if I get 15 minutes and 10 of them. The doctor's on the computer not looking at me or talking to me about anything. So I think we have a completely impossible situation here. And that hasn't changed. There are some medical schools in which there are individuals, as I was, who can produce a nutrition curriculum and teach doctors how to cook and teach them how to ask patients about nutrition. But the best most doctors can do is to refer patients to a dietitian and hope that they have a dietitian working with them who's halfway decent and can actually talk to patients about what they eat in a reasonable way and not tell them to do things that are completely outside their culture or understanding. It's an impossible situation. Doctors are not the right people to change people's diets. Somebody else has to do that.
I think it's a great question, and also a great question, a great answer. I also would add that doctors often don't ask people about some of the things they eat and as to how it relates to the medicines they take, because certain foods actually interact with your medicines. And I've never ever had a doctor actually ask me specifically about my diet.
They can't. It's too complicated. It's just way too complicated, and they don't have time.
Yeah. 15 minutes, you're right, sitting in front of a computer and 15 minutes. Kat, who else do we have? Thank you, Rick. Great question.
Thank you, Rick. So I'm actually going to ask this question. It actually came in the Q&A box. I know you said, Professor Nestle, if you want to eat food without concoctions of additives. But we're wondering if you think labeling practices do enough to inform consumers about the additives in their foods, and if not, what else do you think consumers can or should be doing to make those informed choices, or what else should the industry be doing to make sure that labeling practices actually do what they're supposed to do?
Well, I'm laughing because this is another anecdote. When the nutrition labeling law was passed in 1990, the FDA, in order to decide what was actually going to go on the nutrition facts panel on the label, did a lot of consumer research. And and the way they did that was they had lots and lots of different labeling options that they showed to people in focus groups and that kind of thing. I mean, they did a lot of work on that. And what they discovered was that nobody understood any of the labeling prototypes that they were shown. And so the FDA picked the one that was least worst understood. I'm not kidding. So nobody understands food labels, and there are reasons why they don't. I mean, they're particularly complicated because of the daily value, and for some things, the daily value is the most you're supposed to eat in the day, and for others, it's the least you're supposed to eat in the day. And you have to know the difference. So that's why there's been a big push internationally to try to put labels on food packages that sort of summarize what the overall nutritional quality is. And the ones that are most successful are the warning labels that are on products in Latin America. And I was in Mexico some months ago and was astonished to go through a Walmart there and see that half the products in the center aisles had warning labels on them because they're ultra processed. They have too much salt, sugar, fat, or calories in them. So the FDA has proposed a label that will mark a product as healthy and a label that will warn people that there's too much salt, sugar, and fat or calories in them. And what's going to happen to those proposals now under this administration, I have no idea.
Which countries, you mentioned Latin America, which other countries do you feel are doing a good job at addressing this issue of food additives? You touched on Europe for a minute, but I'm curious as to where the United States, should be looking maybe for some guidance as well.
Oh, I think we look at Mexico, Brazil, and Chile. Chile was first in putting warning labels on high fat, sugar, salt, saturated fat products. And it did that because there was a pediatrician who had gotten an appointment in the Chilean Senate and was very, very concerned about children's health and managed to get this law passed. And then other countries in Latin America followed suit. And what's interesting about it is that if a product has a warning label, the company is not allowed to market that product to kids, and they're not allowed to have cartoons on the package. They're not allowed to sell those products in schools. I mean, those kinds of things. Various countries have different collections of those kinds of laws. But Latin America is looking at us and saying, if we have the kind of prevalence of obesity that the United States has, where 75% of American adults are overweight or obese, and obesity is such an enormous risk factor for type 2 diabetes. We can't handle type 2 diabetes. We don't have the medical manpower, woman power. We don't have the resources. We don't have the money in the healthcare system to pay for this. Let's prevent it. And that's why they were able to get these laws passed. But we're Americans. We don't do things like that.
Yeah, but we've been successful. And I was thinking about this, about how hard it is to change, particularly when there's strong lobbies out there. But we had on a couple of weeks ago Matt Myers, who was the founder of the Campaign for Tobacco-Free Kids, and he was talking about how much America has changed and how kids do not smoke cigarettes anymore. So, I'm going to stay on the optimistic side here and think that it is possible that we're going to be able to change this, just like we changed that, because that's a strong lobby as well.
But I hope it won't take as long as it took.
That's a good point. That is a very good point.
I mean, that was decades, literally decades. And, what happened during those decades has been very well documented. Endless use of what's called the tobacco industry playbook, which was deflecting attention from the research, casting doubt on the research, buying researchers to do the kind of research that they wanted, and that kind of thing. The food industry does that too. Does all of those things.
Strong force out there. All right. Strong force. Kat, who else do we have?
I'm going to bring up a question from the chat. Joe had a question.
Hey there. Thank you so much for doing this. This has been really, really interesting. One question that I has a lot of times, we'll go shopping, especially at places like Costco, and you've got, okay, great, organic foods and all this sort of things. A lot of things that I see on the label are natural flavors, no artificial flavors, natural flavors only. What are natural flavors? I have no idea. I don't think they're required to say what those are. Are they actually natural? I would love some insight there.
Oh, I just love these questions. They're all so funny. The FDA has a definition of natural. It's anything that's it's anything that's not unnatural. Thank you very much. So natural flavors are flavors that at some point came from a real food, but they've been subsequently processed. And the flavors that came from the foods may have nothing to do with what the final flavor is. There are flavor chemists who do this kind of thing. And they're very clever about it, but they're ones that they're extracted flavors rather than synthesized flavors. I think that's the only difference, but chemically they would be identical. No, and they don't have to say what chemicals are in there. They do not.
Is there any potential harm in that processing of the flavors to extract anything for us, that would raise concern whenever we're buying foods that have that in there?
Yeah, I mean, the people who have dealt with the classification system for ultra-processed foods say if natural flavors are in the food, it's ultra-processed. So natural flavors are an indicator of ultra-processed foods, as are artificial flavors. So when you see food products, they often say natural flavors, artificial colors. But even if they just said natural flavors, that would be enough to make it an ultra-processed food by definition. Eat real food. You want to avoid them? Eat real food.
I think that's the key. Sorry. Thank you, John. That's the key takeaway, I think, is that eat good food, healthy food, and real food.
Learn how to cook. It has.
I was like, everyone, I think happens. Everyone is so pressured for time that all of this is an easy answer, an easy fix to a problem. I mean, I even remember when I was a kid, there were foods that were out of season. They literally were out of season. You couldn't get certain things, at least in the fruits and vegetables. And now you can get anything any time of year. And it always looks great. That's the other thing. It always looks shiny, and apples look beautiful, and everything looks nice and shiny. But I guess that goes back to the marketing that you were talking about.
Well, and also selection of particular varieties that ship well.
Right. Good point.
How they taste is not an issue.
Well, that goes back to the industry, the business part of this. Kat, who else do we have?
That was the last of the questions that I've received in the chat.
Excellent. Well, we are actually at time. So, Professor Nestle, thank you so much for discussing this. This is a very timely issue of food additives, and you are correct that this is right at the forefront right now. And I hope that the government, the federal government, is successful in the ambition that they have put forth in getting rid of these food additives. I'm sure you're thrilled. I'm sure you're thrilled that the work that you've spent your entire career on, is getting even more and more attention. So hopefully we'll be successful with the goal. As for me, I will savor the fresh bread. I'll put a little olive oil on it the next time I go to Geneva, and hopefully even here in the United States, to make sure I eat the fresh bread, even if it ends up stale the next day. Well, that's our show for today. Next time on Docology, my guest is my good friend Ambassador Nancy Brinker. She started the Komen Foundation in memory of her sister, and has been a huge advocate for women's health for decades. And we are going to discuss her work on cancer screening and the need for community efforts to tackle health problems, and also about how she started the Komen Foundation and where it has gone from there. But remember, if you are a Docology subscriber, you can join the show. You just have to click on the link in the bio. So tune in next time, because the topic we discuss may just save your life. Docology is a production of Hang Media. Our producer is Catherine Warren. Ronnie Selig is editorial advisor. Our creative director is Anna Richard. Janine Wilson of Wilson Media Group handles paid marketing. Our publicists are Leslie Ann Wade and Jerry Caracoli. Theme music was composed by Nick Kitts. Subscribe and join our community at docology.life. Until next time, move, wash your hands, and stay healthy.